in halls such as this, where your predecessors, where Dave Dubinsky himself actually stood, where another former president stood, and fought this issue out of Social Security against the same charges. This argument that the government should stay out, that it saps our pioneer stock. I used to hear that argument when we were talking about raising the minimum wage to $1.25. I remember one day being asked to step out into the hall, and up the corridor came four distinguished-looking men with straw hats on and canes. They told me they had just flown in from a state in their private plane, and they wanted me to know that if we passed a bill providing for time and a half for service station attendants who were then working about 55 to 60 hours at straight time, it would sap their self-reliance. The fact of the matter is, what saps anyone's self-reliance is working 60 hours at straight time, or working at 85 or 95 or $1 an hour. I understand that there's going to be a program this week against this bill in which an English physician is going to come and talk about how bad their plans are. It may be, but he ought to talk about it in England, because his plan and what they do in England is entirely different. In England, the entire cost of medicine for people of all ages, all of it, doctors, the choice of doctors, hospitals, from the time you're born to the time you die, are included in a government program. But what we're talking about is entirely different. And I hope that while he's here, he and Dr. Spark and others who have joined us will come to see what we're trying to do. The fact of the matter is that what we are now talking about doing, most of the countries of Europe did years ago. The British did it 30 years ago. We are behind every country pretty nearly in Europe in this matter of medical care for our citizens. And then those who say that this should be left to private effort. In those hospitals in New Jersey where the doctors said they wouldn't treat anyone, who paid their hospital bills through Social Security, those hospitals and every other new hospital, the American people, all of us, contribute 1/2, 1 or 2/3 for every new hospital, the national government. We pay 55% of all the research done. We help young men become doctors. We are concerned with the progress of this country. And those who say that what we are now talking about spoils our great pioneer heritage should remember that the West was settled with two great actions by the national government. One, in President Lincoln's administration, when he gave a homestead to everyone who went west, and in 1862 he set aside government property to build our land-grant colleges. This cooperation between an alert and progressive citizenry and a progressive government is what has made this country great, and we shall continue as long as we have the opportunity to do so.